Not.
And we are live.
I just had to switch my. Oh,
we are live. Hello, everyone. Thank you so much for coming to our panel. To all of our viewers, I am very excited to have this. I think this is a very needed conversation, and I'm very excited for our panelists to be here. So I'm going to start off introducing myself. Hello, I am Elio Garcia. I use he, they pronouns, and I'm going to be your faithful moderator for this hour that we have together. And now I will open it up to the rest of our panelists to introduce, starting with the person on my right, who is Deja.
Hello, everyone. My name is Deja Cabrera. My pronouns are she, her, hers, and I am the community health educator and advocate at the San Diego LGBT Community Center, and I am also an empowered trans woman. Thank you for having me.
Awesome. Thank you so much. And then, Ollie, do you mind introducing yourself?
Sure. Hi, everyone. My name is Ollie, and I go by he, him pronouns, and I am a master social work student and an intern / volunteer for TransFamily, and I'm happy to be here.
Awesome. And then last but certainly not least, Dr. Jill.
I was glad you threw in the last but not least. I'm Dr. Jill Blumenthal, and we decided today we're going to go with Dr. Jill. My pronouns are she, hers. I work at University of California, San Diego Health System, where I am an infectious diseases doctor, and I spend most of my time working in the field of HIV and HIV prevention, and I see a lot of transgender individuals for gender health. And one of my favorite things to do is just talk about sexual health. So I think I'm in the right place for this.
I think so too. I'm very excited for this. I do want to mention before we begin that we are partnering with Good to Go San Diego. So thank you very much for them for partnering with us. And now we get to the fun part, which is the questions. Okay, so I do have a list of questions. We're just going to go through, get as much as we can get. And then please don't worry if you kind of like go off topic, because this is more a conversation than it is like a formal answer the question type thing. So first of all, pretty standard, talking about more relationships, sexual relationships. How can someone stay safe during casual sex? More specifically, to prevent things like sexual violence, which, as we all know, is a little bit higher in the trans community. Sorry, coming in a little bit heavy. But this question I'll have open to anyone who feels comfortable answering.
Yeah, I don't mind starting. I think it all depends on the type of sex the person is having. I know for me, to protect myself, I'm on PrEP. And so that is the tool that I use for my sexual health.
Awesome, thank you.
And I think regarding violence, it's the person feeling out where that disclosure piece fits. If that's before entering that situation, or if they feel that it's safer to wait a little longer till they know somebody a little better, making sure that it's maybe something that's discussed before being alone in someone's house or someone's room, those type of things. But I think it's a personal situation. My comfort with disclosure is not going to be the same for somebody else. So I think that's where my head goes for that answer.
Yeah, I absolutely agree. I definitely think that there's a lot of controversy of, especially with trans people, whether or not we should disclose immediately if we are transgender or not. And I personally think that it's all about safety. You know, if you feel safe with whoever you're with, and you think, well, we're going to take this extra step and this is going to become a sexual relationship, I should probably tell them. Versus like if it's just a one night thing, you meet someone at a club and it doesn't seem worth it to tell them, to just prioritize safety. Awesome. And this is a little bit related in the relationship area, but how do you navigate dating cis folk with, this idea that cisgender people may have with genital discrepancy?
Yeah, I think cis people have, they watch a lot of porn, and they have this fantasy. And for me and my own experiences, right? So for me, it's really getting to know the person and for them to really get to know me. I have what's called passing privilege. So it is difficult for me sometimes to disclose I'm transgender because, I don't know what the outcome could be. So definitely echoing the first part of safety. Yeah, it's my 2 cents.
So, and then does anyone else want to share any thoughts? If not, then I have another question.
I was going to say, I think it kind of goes back to the same thing when that comfort is there and what feels right for you and that relationship, whether it's something that you feel is going to go a little bit further and could be long-term, or is this kind of a superficial, you never really know when you tell somebody, whether it's a relation, a friendship or a sexual relationship, or like for me, I was worried when I told my family like I'm a trans man, what they were going to think. So I think that goes kind of across the board with people because you never really know what people are going to think. And so for me, some of that is sitting down with a conversation and explaining about my body, because my body is different than somebody maybe would expect in a lot of ways, not just in a sexual way, but health-wise. I've had conversations with folks I work with. If something happens and I have to go to the hospital, here's things that are different for me than would be different from a cis man, which I also have passing privilege. It was something I always wanted, but then it leaves this awkward conversation of assumptions that people put on me that I didn't experience. Yeah, I don't know if that makes sense, but
Yeah, absolutely.
And I would just add that it's like small things too with passing privilege. I know for me, I get text messages about women's exams, and guys keep sending me these text messages, and I'm ignoring them. So it's good and bad. It's complicated, especially when it's your healthcare system, because you want them to know your body, you want them to know you, and we're taught that there's a man and a woman, right? But there's queer bodies, and queer bodies should also be celebrated and uplifted and learned about.
Absolutely. I absolutely agree. And speaking of healthcare systems being knowledgeable on queer bodies, Dr. Jill, this question might be more directed towards you.
I was hoping I could join in the discussion. No, just kidding. I love hearing from Deja and Ali. It's great.
Absolutely. So what kind of contraceptives exist for, having safe sex? And are there any type of contraceptives that are more or less effective for specific types of sex? And that might mean like, contraceptive for people that are having sex that both have vaginas or both have penises.
Okay, big topic. But generally, when we think about contraceptives, I think about contraceptives doing two things. One, protecting against sexually transmitted infections and HIV. HIV is a sexually transmitted infection, but sort of the other group, plus HIV, and then contraception against pregnancy, which is something that I think with transgender individuals, it's so important to talk about. It's something I make sure I'm talking to every patient about, regardless of what genitalia they have, and just wanting to know what their intentions are. And because the fact is, lots of people get pregnant in different ways. So for the purposes of this, though, I think we're talking more about sexually transmitted infections and HIV. And the mainstay of the main contraceptive method that's used is the condom. And we have different condoms. The traditional condom which has been unfortunately termed the male condom. And that's not what we call it, but it is the condom that would go, on the penis. There are also condoms that can go inside the vagina. And those we think more of as insertive condoms. Those would be the best. Those would be good, certainly for penis and vaginal sex, and really using fingers or tongues in those areas. The other contraceptive that we talk about that is probably used a lot less, but I think is a great option, is the dental dam, which has a terrible name, I realize. But dental dams can be great for oral sex or mouth really on any hole. It's a nice thing that you can layer above the hole that you might be using. And it's a nice and easy way. A lot of them are flavored. So people find that to be effective. I would never say to use a dental dam though for penetrative sex. They do not work as well. Now those are just the barrier methods I'm talking about. Deja already alluded to the fact that she takes PrEP for her health and well-being. We know that PrEP, which is now available in a couple of pill forms, is up to 99% effective in preventing HIV. So that is also a form of contraceptive, but just specifically for HIV prevention. I will stop there and see if Ollie or Deja want to add anything else.
I think you did a great job of covering that. I was just thinking, some folks that I know, sexual health tip. Dr. Jill, you tell me if this is right, but this is what the girls are doing out in these streets. Okay, they are getting condoms and they are cutting them and like rolling them out and using that as a dental dam.
Ooh, I don't love that. I don't love it just because of once you manipulate rubber, the chance of you inadvertently nicking it, when you look at, I'm going to be a little geeky for a second. When you look at studies on the effectiveness of condoms, they're actually at 80% for vaginal sex and 70% for anal sex. This is all comers. This is a huge study, but right, doesn't that make you go, what? I thought condoms were like 96% effective. The reason that it's as low as that is people don't use them right. They're not always taught how to use them. And then there's the malfunction issue, and maybe the size issue as well. So just the idea of cutting it makes me nervous. You're going to nick something. We were actually having a discussion about dental dams, as sometimes happens. And I quickly Googled it, and I swear I don't work for Amazon, but you can buy dental dams very easily now, and they probably are very cost effective because who's getting dental dams these days? I just think that would be a little bit safer than to cut a condom. It would make me a little bit nervous, but sometimes like try some safety, if you want to give it a go, try something as opposed to saying, I don't have anything. I'm just gonna do what, I'm going to do it with nothing. I do think maybe sometimes something is better than nothing for sure.
Yeah, I know some folks who've grabbed the good old saran wrap out of their kitchen cabinet.
Yep. I just recommend if you're grabbing the saran wrap or cutting the condom, please go and get yourself tested for HIV and STIs, probably about a week or two later to make sure that you are still safe and doing okay.
Yes.
We can talk about testing later if you want.
Actually, that's a really good segue into one of the questions that is about testing for STIs and how exactly that works for anyone who's never gotten tested, and also for transgender people who may be nervous about disclosing, where they might be coming in contact with genitalia and what genitalia they're coming in contact with.
It's a great
So
question.
Again, if anyone wants to answer.
Yeah, let's see, since I'm on PrEP, I get tested every 3 months, and I do a full screening with my insurance at Kaiser. And so I am swabbing, and I am peeing in a cup, and I am giving what seems like 16 vials of blood. They also take hormones and all, I get everything, all it done all at once. So For me, that's kind of my routine. But I've also have done testing at the center and at To Go, and it's very comfortable, I think, for me to walk in and immediately be greeted by a community member is just great, you know. So it puts me at ease. It lowers my anxiety, and I'm a little bit more confident talking about my sex life when I'm talking to someone who looks like me, as someone who understands, and, you know, someone who just will get it.
Absolutely. And I love that, here in San Diego, we do have these resources available in order to be both comfortable and healthy. And then here's a similar question in relation to testing for STIs. When should someone get tested for an STI? Should it be after any sexual encounter? Should it be once someone suspects that they may have an STI? When is a good time to be tested?
I don't mind taking that one since it's what I spend a lot of time talking about. The answer probably is it's never a bad time to go get tested. If you feel like you should get tested, do it. There is a small segment of the population that we would call the worried well, who after a little while we probably say, hey, you don't need to test as much as you are, unless there's something, that we're missing. But generally, the rule of thumb I use, and really it is person dependent. If you are a sexually active young adult, right? Because we're talking young adults here, I believe. You probably should be getting tested at least once a year. Now, that the frequency increases if you have certain sexual behaviors that increase your risk for HIV. And very, very plainly, we know that individuals who engage in anal sex and are the bottom are probably at the highest risk. But generally speaking, but also if people engage in vaginal sex as well, and you're not using condoms regularly, it's good to get tested potentially more frequently. For patients there are some patients who, are really getting out there, enjoying themselves. I am a sex positive person. I think people should enjoy it, explore it, just be safe about it. Those people, I might say, I actually use the rule of threes for patients. If you have 3 partners in 3 months, I want to see you every 3 months, which sort of ties in well to PrEP, because that's someone who may need PrEP anyway. It gets a little bit trickier when we're talking about vaginal sex alone, where we know that perhaps the risk depends a little bit more on the partner, and the frequency may not need to be quite as much. But I sort of give that spectrum somewhere between 3 and 12 months for how frequently you should test. And hopefully you find a place where you can say to your provider, hey, how often should I be coming in? And this is where we hope that patients are honest with us. At least me, I want to know what's going on. If you don't tell me, then I can't, do everything that I, like to be able to do or to help you the way I'd like. And I don't like using the other rule of threes, which is, multiply by 3. If a patient tells you this is the number of partners they have, I don't want to do that. I'm going to take you at face value. So just say what's going on. And then based on that, a provider who has experience in sexual health and trans care should be able to help navigate that for you. But that's sort of the general rule. Now, when you should go outside of these windows would be if you're experiencing any sort of symptom of a sexually transmitted infection. So that would be, pain when you urinate, discharge from places, maybe a new rash that doesn't seem right. Then you should go and see someone sooner.
I'll also add that in the state of California, you can be 13 or older to get an HIV test. And I will mention that you don't have to have sex to start getting HIV tested. So if you're a young person who just wants to experience what HIV testing is like, it's a simple prick of the finger. And yeah, I would ask, do some research and see where you can go get tested.
Sorry, you
Absolutely.
just gave me the chills when you said that. I'm sorry, I didn't mean to interrupt. But the idea of people being so informed to actually say, I'm not there yet, but I kind of want to know what the experience is like so that when it is time, it won't feel so scary and I won't be terrified, in that experience. I really love that, Deja. I've not thought about that so much, but I like that idea of sort of giving it a whirl. Even if your risk isn't that high or it's not happening for you yet.
Absolutely.
Yeah, that's a really great point, especially for like our young adults, that are transitioning from high school age into college age. Maybe they've only really been sexually active with one partner and their risk factor isn't huge, but they might not know what it's like. And so this idea that you can absolutely go get tested and see what it's like, just so if it happens that you do need to get tested for a higher risk factor, it doesn't seem so scary. And then actually kind of related to HIV, Deja, that you mentioned. So I see a lot of HIV AIDS in like commercials, in news articles, but I know they're different. So what exactly is the difference between HIV and AIDS?
Yeah, to put it simply, HIV is the infection and AIDS is the diagnosis. Dr. Jill, do you have anything to add?
Yeah, no, that's good. The AIDS also, so if you have HIV, it doesn't necessarily mean that you have AIDS. AIDS is the progression of the HIV to the point where your immune system isn't working as well, and you may have developed certain signs and symptoms, infections or diseases that only happen when the body's immune system is suppressed. So while everyone has, or anyone who's diagnosed with HIV will carry the HIV diagnosis until we have a cure, which I'm confident we will, because go science. But not everyone goes on to develop AIDS. And really, one of the great reasons for testing. Listen, we wish no one to ever have to get any infection in their life. I wish everyone a life free of any infection. That would include influenza, COVID, whatever it is. But life happens, things happen. And if you do find out that you have HIV, it is by no means a death sentence in any way. It is an extremely livable infection that you have. And we know that people live totally long and healthy lives. It just might mean that you're seeing a doctor a little bit more. It's not always the worst thing. Some of us aren't so bad. But the idea is the earlier that we diagnose it from its progression, the better people do overall. And these are the people that we know may have a better likelihood of cure happening because perhaps the HIV hasn't really settled into their bodies in different ways. But unfortunately, we still do see AIDS diagnoses, and I think stigma is one of the big reasons, but there are a lot of other reasons. So,
Absolutely, and I definitely agree, and think that in especially the LGBTQ community, with the HIV pandemic that we had in the 80s, there is that huge fear of, oh my goodness, I have HIV and I'm gonna die now. But as Dr. Jill just mentioned, it's not always a death sentence. And especially with modern medicine, I don't know if, I'm pretty sure all of y'all already heard about the vaccine that Moderna is developing. I'm so excited. My partner and I both, when we read the article, we were crying. We were like, oh my gosh, this is great. So it really does get better. And, it's not such a scary thing. So moving on, you found a partner, y'all have been tested, you're so excited. It's time for the sex to happen. There are a lot of questions about the specific, logistics of sex. First of all, I know Ollie, we're both trans-masc, have been on hormones. And with hormones, especially for me, I've not had bottom surgery yet, there is vaginal atrophy that happens. So how does vaginal atrophy, and this is both like from the clinical side and from experience, I can also answer a little bit, but how does vaginal atrophy in trans people on masculinizing hormones affect sex? Penetrative sex, masturbation with penetrative toys? I can't speak. And what should transmasculine people that are on hormones and have not had bottom surgery be looking for in terms of possibly hurting themselves?
I wasn't sure if you were going to start, Elio, first. To be honest, I don't have much experience with this. I am one of the few trans men before bottom surgery that I was lucky and didn't have vaginal atrophy. I will say that lube is your friend. Lube, all the lube, there can't be too much lube. Lube of all kinds, and now they make flavored lube and all sorts of stuff. So if you don't like one type, try something else. Buy an array. But that's really the only information I have. Elio, you might have more information than I do.
Yeah, awesome. I do have a little bit of experience with this, obviously, because, I am transmasculine and I have not had bottom surgery. And from my experience, I found that, with penetration and masturbation, I still bled. And that was something that I was not really prepared for. For some reason, I had it in my mind that once I was on testosterone, I wasn't going to bleed anymore. And then it happened, and I was like, what is this? Is this my period? Is this my hymen? I'm so confused and nervous. And then it stopped after like 2 days. So I figured, okay, maybe it's normal, maybe it's not. I'm not sure. But from my personal experience, I did bleed, and I was confused about it. So Dr. Jill, I'm not sure if you have any information about like breakthrough bleeding or why that happens.
Sure. This is a great question. And I know this is about trans people. I will just say, this absolutely happens to cis women as well. And at different, vaginal bleeding, unfortunately, can occur during penetrative sex. Everyone's mucosa is a little bit different. So some people with very little penetration can get the experience of bleeding. And then, fortunately or unfortunately, I think that the case is unfortunately here. We know that testosterone can maybe worsen that for some people. I think the key is, right, don't freak out if it's happening. And don't immediately go to, oh shoot, my testosterone's not working. It must be my period again. Because for those who have had their period for years, you kind of know what's going on with your period. Like it's not just an isolated, and it shouldn't happen just after you have sex. So it's more likely related to some sort of tear or just a little bit of an abrasion. I agree wholeheartedly with Ali that lube is your friend. Don't be afraid to use it. Don't be afraid to say, I need it, I want it. That's definitely one way to help you. I think something that often comes up as well in this arena is, would vaginal estradiol, so local estradiol, help in that situation? And again, the answer is it depends. It's not going to work for everyone, but it could be an option for someone. And this is where I usually defer a little bit to my gynecology colleagues who have more experience. Whenever I send someone to them, I read their note, and it seems like it is a little depend on what's going on. But I think people get concerned, well, if I'm taking estrogen, that was the whole point. I didn't want the estrogen. It's local. So the idea is it's not going to build up in the system. It's not going to affect your testosterone levels. So that could be an effective strategy. It's not something I would just try, on your own. I would talk to a provider about it. And I always say that and then get worried because I know not everyone has a provider that they feel comfortable talking about things with. And that can be challenging. But more and more people exist out there that can do this, and just ask your friends, ask other people, who can I talk to about this? I wouldn't just, try to start doing it on your own, but start with the lube, because that you can definitely do on your own. And don't panic.
Yes, absolutely. Not panicking is great advice. I wish I had that advice because I did panic a little bit, but we're all good. And then kind of related to the localized use of estradiol, if someone were to use something like topical estrogen cream, would that affect their testosterone levels? That's what I just said. It shouldn't. It won't.
It's fast acting, and it's not meant to be, it doesn't have a systemic effect, so it doesn't get into the bloodstream. So that would definitely be a potential way to do things, to keep the sexual health moving and things going. But again, I'd talk to a provider about that and not just try that on your own.
Absolutely.
And I do know folks that have used that, and what I've heard helps them is to incorporate that into their sex life with their partner or with themselves, so that it doesn't feel like a dysphoric thing or situation. Because often, like Dr. Jill just said, as a trans guy, the last thing I wanted to do was anything that added estrogen to my body. And I had looked at donating eggs and then found out what they needed to do. And I was like, nope, that's not what I want to do. And so I would hate for somebody to veer off of something that could be better for their health out of dysphoria, but I completely understand the dysphoria that kicks over. But trying to incorporate that, getting yourself comfortable with it first, and getting comfortable with that with a partner if you have somebody to share in that with, as to the reasoning to incorporate that into your sex life. Y'all's sex life.
Ollie, I'm really glad you said that, because I that is definitely part of the conversations I have with patients, which is I'm going to make a suggestion, but it may not be something that you're interested in doing because of what it is. And then I try to focus on the fact that it's really, it's more about sexual health. It's less the name of it. It's not meant to be, something that's binary or focused on that concept of masculine or feminine. It really is about sexual health. And I love the idea of saying, let's make this part of our sexual health, so that, maybe that does help, mitigate some dysphoria that could occur. It's a great point.
Absolutely. I definitely agree. And then a little bit related to this idea of, vaginal bleeding and vaginal bleeding during sex. When is it time to be concerned? How do we know when it's, normal vaginal bleeding versus vaginal bleeding that may need medical intervention?
I think that one's for me, but anyone can try to, well, I'd be curious to hear what other people think. Okay, it depends on what we're talking about. If you're taking testosterone, and maybe new to testosterone, and your dose is being changed, you may continue to menstruate, have bleeding during that period of time. And if the dose for some reason is adjusted, I once had a patient, this has really only happened one time, where we went through the dosing, and they because of for those who have injected anything, we had confusion over the etch marks, and they ended up dosing so much less than we had intended for them to do based on the prescription. So they kept getting their period, and they're like, I'm very concerned about this. And it ended up just being a conversation of, oh wait, somehow when I said 0.5, you took that as 0.05. It was this is where math is important, in making sure patients understand what it is you're talking about. So in that situation, if you're taking testosterone and you think at this point, I shouldn't have my period anymore, I think that's definitely a time to get in touch with the provider. Ask, this is something unusual. If the bleeding happens in the context, like we said, of, sexual, of having sex, if it's light bleeding, probably nothing to be concerned about. What we usually talk about, is, how many pads you're soaking and stuff. And I hate talking about that in general. But gynecologists don't mind talking about that, and blood isn't a big thing, although I know it can cause, dysphoria for some people. If you put like a lining in or a pad in and it's soaking, that's when you need to talk to someone. But light bleeding really can be normal, and it may just be something that needs to be, to address at a next doctor's visit. I'm having some light bleeding. What do we think this means? And usually, it could be that the testosterone level isn't high enough, that needs to go up. It could be related to sex. It could be connected to this, vaginal atrophy. So we've sort of hit the things of what it could be. But if you're not having to change a pad regularly, don't panic. Just calmly call your provider and say, hey, can I see you about something? And maybe between the time you get in there, it'll actually have gone away.
Absolutely. And then as someone, who is transmasculine and does not have bottom surgery and is sexually active, one thing to be aware of is like, what kind of activities are you doing and making sure it's safe. So making sure that, if fingers are going inside a vagina, that fingernails are adequately trimmed and, buffed so that you don't accidentally nick anything. Or if you're someone that likes having long fingernails, to have some sort of padding. I know they do make finger padding that goes on your fingers to prevent, ripping or nicking with long fingernails.
They look like finger condoms. They're like only go halfway. They're not like, don't ask me how I know, or do.
Yes, absolutely. So if you're someone, who wants to be the penetrator with your fingers, but also want to keep your long nails, there are ways to do that. And also be aware of pain. If you're bleeding after sex and it's painful to touch yourself, it's painful to wipe, that might be a good indicator to maybe go check that out to make sure that you didn't hurt yourself, that you are all good.
I forgot to mention that if it's a pain that you're not happy with, that probably means you need to get checked out. So pain, but light bleeding, yeah, could be problematic, especially, I don't want to tell everyone run to the doctor within, an hour of it happening. Try to rest, relax, see what's going on. But if the pain persists, that's something that needs to be checked out.
And I think kind of touching back on what we were talking about now, what we talked about earlier, I think a lot of it goes back to being able to be comfortable with yourself and your partner to express if there's discomfort or pain, or maybe that doesn't feel right, or, being able to ask for a lube, those kinds of things. And a lot of it goes back to knowing your own body, but also having a relationship with the person you're with that you can ask for those things for yourself and speak up on your behalf, because you're the only one that can.
Absolutely. And making sure you're present with your partner for any stop or any ouches that may happen, to just,
Yeah, because something that might have been okay last time may not be this time. And whether that's physically tolerating it, dysphoric, that you may be in a different emotional place, all of those things are important to be able to speak up, and goes back to your safety and your health in a variety of ways.
Absolutely. And then kind of on the same side or different side of the same coin, for trans feminine people, being on hormone replacement therapy, on estrogen, also affects the way that sex looks for them. So the question that I have is, how does estrogen impact ability to hold an erection, sex drive, and do medications like Viagra help people that are on estrogen maintain an erection?
Well, I have not been on that blue pill, just the PrEP. But I will add that for me, getting on hormone replacement treatment, because I don't think trans people need therapy treatment. For me, my sex drive enhanced. It's very much enhanced. But for me, it also, I feel like, comes in waves. There's times where I don't even want to be looked at. Don't even look at me, but then there's times where I do. So for me, it happens in waves. As far as holding an erection, I haven't had any complaints.
First of all, everyone could use therapy for anything. Therapy's great. I'm with you. I hear you. This is actually, I'm really happy for Deja. This is not something that she's had to experience. It definitely can be an experience of trans women or trans feminine individuals taking estrogen. We know that it can suppress, and we know that the goal is to suppress testosterone, which along with it can also bring along libido and also erections. So whoever asked that question nailed it, which is that erectile medication or medications that we use to make erections, like Viagra, are a great option and something that we absolutely will prescribe. Similarly, what we talked about in terms of using the estrogen cream for the vagina to protect it, Sometimes we'll use or recommend using local testosterone gel, just sort of around, a sexual encounter for someone who may be having some, a hard time. Sorry, no pun intended. Yeah, I know. Having, is having difficulty with an erection. So yeah, that can happen. And I've had a few patients where and this should really be discussed with patients, when we start estrogen medication, these are some of the possible side effects. And there's some patients that, regardless of what you tell them, when it happens, they're like, wait, no, this wasn't what I wanted. So sometimes it will mean, lowering the dose if that is very important to someone, or trying some other strategies, including Viagra or something else, or maybe some local treatment, local testosterone treatment to help with the erections. So there's certainly ways around it. I had one patient very creatively say to me, because they're long-acting injectable erectile dysfunction drugs. But the idea is you're not erect the whole time, so you don't get one and it stays erect. But the way that it works is it stays in your body for a while, but at low levels. So is that something that they could get, so that when they're active, it could work? So that's actually, I sent that person to discuss that with our urologist, who fortunately at UCSD, many of them are very, they're affirming and they understand gender health, and we're excited to see the patient, but the patient didn't go. So I'll have to get back to the group on if that's something that, could work. But it's very good to know that, not everyone has those experiences, and that it may have no effect. In fact, it may go in the other direction because of helping, of helping that gender dysphoria, of making you feel like more of who you are, and then feeling good about yourself and enjoying that sex.
Absolutely. And then similarly to how hormones can change the way that we're experiencing sex with other people, hormones also affects the way that we're masturbating and experiencing our own bodies. So I'll have this open for anyone. How does hormones specifically change the way that masturbation happens / could happen in general, or happens / has happened for you? And then I can also answer if no one else would like to answer.
Yeah, I'd say for me, hormones definitely changed my body. And so it was really fun for me to just touch my body, just because even my skin was feeling different. What I was feeling was different. Developing breasts was great. And so for me, it was more so exploring my body, being body positive, or body affirming, and sex affirming, but also pleasure affirming. For me, sex has to feel good for me, and of course for my partners as well. And so it's just important that there's a lot of communication happening. And so for me, it was more so I need to explore my body to figure out what I like, what turns me on, what don't I like. I don't like this, I don't like that. And then also getting comfortable and confident exploring my body with someone else. The touch of someone else is also different than me touching me, so it's definitely an exploration. Even now, I think as I step into my queerness and having sex with other queer folk, with other queer bodies, and not just cis men, is fun. And it just feels like we're just learning each other in a consensual way. That's also pleasurable.
Absolutely. I love this idea of making sure you're comfortable with yourself, and that you have those open communications with whoever you might be. I know I like this, and I know I don't like that. I know that for me, when I first started on hormones, my libido shot up. I was so excited all of the time. At some point, was something I never really had to deal with before, because I was used to an estrogen-based sex drive. So then having to transition to a testosterone-based sex drive, it was almost a little bit annoying. But I was just very excited all of the time. But along with that, my genitals changed. changed. My clitoris grew, which, commonly for people that are on testosterone, bottom growth. And learning how to masturbate again was a learning curve, because what used to work no longer worked. And then things that I felt were pleasurable before were a little bit too much now, and places that I could touch myself before were a little bit too sensitive and kind of hurt. And so just doing that learning curve. And then once I, started becoming sexual with my partner, making sure that I told them, oh, these are the things that, I like. These things, you might want to be careful if you touch me here and here, because it gets sensitive too fast and it might start hurting. And then Ollie, I know you have bottom surgery already, so I'm not sure if it was different for you or similar.
Yeah, I would echo everything that both you and Deja said, with getting to know your body and realizing that at each of those surgeries things change. So first I had metoidioplasty, and there was a length of time between metoidioplasty and phalloplasty, and so learning my body then, and things like you just said, things that felt good before were suddenly too sensitive, things that used to feel wonderful didn't do anything. It was like I didn't even know myself, and it was kind of this weird, like, oh my gosh, what did I do? And when I first started hormones, I remember I wanted to be eating, sleeping, or having sex, and if I wasn't doing one of those three things, I wanted to be figuring out how I could be doing one of those three things, because I was like, I can't imagine going through this as like a 14, 15-year-old boy. Like, I couldn't pay attention at work, I couldn't pay attention at school, like, it was ridiculous. And then fast forward, when I had phalloplasty, it was the same thing all over again. And then I actually had an implant a couple of months later, and so each of those surgeries changed nerves in my body. Each of those created places that were sensitive to heal from a surgery site, were sensitive to heal from an implant, or incisions, things like that. And so all of that was a learning curve, and I can't express. I also have Kaiser, and I can't express how thankful I am to have that relationship, that I could be very open and honest with all of my doctors. I think part of that was started at the beginning, and it was reciprocated by them, which made me feel very comfortable. Those that weren't comfortable were open and wanted to know and ask questions. I was never dismissed, where I felt like my body was different or something that they couldn't be bothered with or deal with, and even to the point where I've been worried to travel places because if something goes wrong, my body doesn't look like a typical cis male body, and if I have to go in for help or something somewhere, where do I go? And so I never felt that way with my doctors, and I'm very thankful for that, and being able to ask those questions, and then that transfers over to my confidence, which previous to hormones and surgery was non-existent, because I felt like my body was betraying me every time. Like, there's no other way to describe it. And so dysphoria was tough, and it's definitely a learning curve, and it's changing with the new body, especially when that body changes every 6 months. But now that we're past surgeries and kind of that exploring phase of stuff with myself and what feels good and what doesn't, that I couldn't be happier. But I think it's important.
Absolutely. And then on the topic of surgeries and, figuring out how bodies are changed and how sex looks like once you've had surgeries, we do have a question in the YouTube chat. Is Viagra effective for female to male who have had metoidioplasty?
Is that for me? I'm going to go to Ollie.
Well, I'm going to default back to you, but
yeah, please do that. Let's start with you and see where we go.
Let's have a combo answer. So my
that sounds great.
Doctor answer is, I believe the way Viagra works is engorging the blood vessels, which my body did not have when I had metoidioplasty, more than I did as a cis person. So, I mean, as a cis woman. So I don't believe that would be, I think what I've heard most from folks, and what I did as well is, I can't remember what they're called, but it's like a pump, like a penis pump, like Austin Powers style, but
yes,
not like that. Best reference I have.
That's
and so some of that is, people say that they experience change. I would say that I did like in the moment, but it wasn't really long term. And I think I just didn't stick with it because I knew I was going to be having phalloplasty. So it wasn't really something that was as big of a deal for me. But that would be my non-medical answer.
Ali, I think that was a great stab. This is not actually something I have a lot of experience with. Based on the mechanism of action and what Viagra does, it doesn't make sense that it would work in metoidioplasty. That being said, and now I'm doing a pop culture thing, which I probably shouldn't be. I'm from New York, and I'm a big Sex and the City watcher. And for those who remember the episode where Samantha takes Viagra and gets, experiences things from it. So the question is, and I you know what, I'm going to have to come back to the group on this. It doesn't mechanistically make sense that it would have an effect. That being said, there is a lot of complicated anatomy and anatomical things that are done. And maybe there's a possibility. I would say probably not though, but maybe it needs to be looked into a little bit more. So my final answer is probably not.
I love that answer. Honestly, ultimately, probably not, but who knows? Bodies are weird. It might for some people. Okay, perfect. So kind of moving on from like the logistic part of sex, a little bit more towards the relationship bit. Here's one question that I thought was, as a trans person, I wanted to make sure that we touched on is how do you handle someone that may want to just have sex with you because of a fantasy or a fetish, and what to do in that situation for anyone who would like to answer.
I mean, my businesswoman mind immediately goes into effect. That's my experience. I've also just don't engage. I'm not a fantasy. I'm a real person with real feelings and a real heart, with real emotions, and get to know me. And, yeah.
Absolutely. And I definitely think that there's also a conversation there to be had about sex work and this idea that, well, if you are comfortable and you want to engage with someone who may be looking for a certain fantasy or a certain fetish, feel free to do so, and just make sure to be careful because there can be so many risks, not just through STIs, but, the risk of violence. But personally, I think it all goes down to comfort level and, whether or not you want to, and just to be assertive. If that's not something you're looking for, to assert, I'm not looking for that.
Absolutely.
Perfect. And then kind of like an overall question about sexual health and sexual health education. How do we bring conversations about sexual health to institutions like high schools and colleges, where we're seeing a lot of students that may want to engage in sex but don't know really where to start, don't know how to be safe about it, especially around transgender students that, sex ed, at least the standardized sex education, isn't really made for us. They don't talk about our bodies and how hormones may affect us.
Yeah, I think health education, sex education in general, leave out the LGBTQ plus community as a whole, right? So it's really important that when we're talking about sexual health, we talk about reproductive sex and non-reproductive sex, because there are many cis people who are having non-reproductive sex as well. So that's one piece of the conversation. Another piece of the conversation, which I definitely see happening in the future, is trans bodies being introduced as well, and folks learning about them, that, folks can have a vagina and be flat chested, or you could have breasts and a penis. So, I mean, to me, that just sounds like gods and goddesses, in my opinion. But yeah, I do see when we talk about sexual health and queer bodies, we got to talk about it in a non-reproductive way, and also in a reproductive way as well. The non-reproductive way, in my opinion, is the pleasurable way, because sometimes people who reproduce kids is not fun. But that's just my opinion. But that's just me. Non-reproductive, reproductive. Let's learn about it.
Absolutely. And I think it's conversations exactly like this, taking it to folks in the education system that can change those education plans, and who's putting forth, folks calling different people in school systems. I can't think of the words. The
Administration?
That'll work. I don't know if that's what I was thinking of.
I don't know if that's what you wanted.
I'll take it for $500. The administration to say, like, this doesn't represent, not even necessarily this doesn't represent my kids, but this doesn't represent kids in general. This doesn't represent, it doesn't have to be just trans folks fighting for this. It should be everybody fighting for it, where we need allies and we need other people to speak up. And so things like this, to educate people and have these conversations. And I think it was Laura earlier said, like, this used to be a taboo subject, like, to be able to have a conversation like this is going to be streamed in multiple places, and to be able to make this a normal conversation, that it's okay to talk about, my body's different, and that's okay. That's okay to talk about, and that's okay to talk about in a public setting and in a school setting, in sexual health and with my doctor and things like that. And so I think, and I know obviously this is put on by TransFamily Support Services, and they do training with schools, but that's another way. If there's people that just don't understand, starting with the training and getting education as to why this is important, because the what and the why have to go together. If you only have one, they don't really stand as well. But if you can give people the what and the why as to why this is important and what is important, I think that's how we make change.
Absolutely. And I'd add that representation matters. And when our youth are getting education, sex education from folks who look like them, other trans folks, that there's going to be an impact. I go into these schools on, pre-COVID was going into them, now on the Zooms and stuff. But as a trans woman coming in, talking about reproductive sex, non-reproductive sex, health education, sexual health education in a affirming way that is not only sex affirming, but also body affirming and pleasure affirming, is also really important. And language and labels is also important as well. I don't know if you all was catching that I keep saying affirming. I'm trying my best to stay away from positive, just because you mentioned earlier during the AIDS epidemic, it was a bad thing to be positive. People were coming out and being positive and pause. And, and now with COVID happening, it was a bad thing when you were positive for COVID. And so when we talk about being positive, we don't really say that anymore. We're now saying folks who are living with HIV, right? And so we want to be affirming for everybody.
Absolutely. The importance of, representation and being affirming. And again, the change of language, to transition from this idea that sex and LGBTQ sex and trans sex is negative and, is bad and it's taboo, and just fighting for this to be standardized in sexual education for trans people, LGBTQ people, and allies, because the truth of the matter is kids are having sex and we just want them to be safe. And that is actually all of the questions that I have. So I would like to thank all of our panelists for being here. I want to thank Good to Go San Diego for partnering with us. And if anyone has any final words, we would love to hear them.
I'm going to let Deja and Ali and Elio wrap up, but I was phoning a friend really quickly, a urology friend, as we were talking, because I needed to know the answer. And she said, theoretically, it could work. This is not go out and buy Viagra, but, and this is what scientists say, we need to study it. So maybe we'll talk about doing this and get this studied a little bit better. But maybe I'm going to go back from probably not to maybe, but still just don't go out and try and do it yourself. Do it under a doctor's direction. But aside from that, it was such a pleasure to be on this panel. I'm really in awe of the way everyone, how everyone talks about things, so comfortable sharing their experiences. That's so much more powerful than than me, who just like talks to people. Sometimes it means so much more than just, sort of me counseling. That experience is so important. So thank you for allowing me to be part of this group.
Thank you. And thank you for also having me. I think it's so important that we get to come together in a group and have these types of conversations. I just want folks to leave with empower yourself to take charge of your own sexual health. Your body is your body. So do what you can to protect it the best way that you can. Make decisions that are right for you. And again, you have to be at least 13 years old to get an HIV test. So if you're interested in getting tested, look up some information. If you want me to test you, I test at the center. We test by appointment only, Monday through Friday. So give us a call, and we'll get back to you. Thanks for having me.
Love it. And I'm going to echo that. I'm so excited to be a part of this, and so glad that we could have these conversations, that we're able to share this information, that people phoned in their questions that they wanted to know, and hopefully we could at least share a little bit of insight from our perspectives. But same thing, advocate for yourself. There's no better advocate for you. And if you're not sure, talk to somebody you trust, to who to get in contact with, and who you can. Not everything on Google is correct, but finding those that you trust to have those conversations with about your body.
Absolutely. And just to echo some things that are being put in the chat, no insurance is required to book an appointment with Good to Go to get tested. TransFamily, also no insurance required for trainings for schools and institutions, for companies if you want to train your employees. And again, thank you all so much. This live stream is being recorded, and the recording will be available. So feel free to share with whoever needs/wants it. And thank you all for coming.